Well, happy, healthy, beautiful day, everyone. Welcome to this week's Ask the Doctor call. We're talking about diabetes. My name is Eric Higgins, holistic health coach, calling out of Portugal on a mission to impact the lives of 100,000 people in the next 2 years with some epic information. Partnered with none other than Dr. Bob Rakowski here, clinical nutritionist, chiropractor, kinesiologist, global health expert, functional medicine doctor of 30 plus years. He is the head of the Natural Medicine Medical Center in Houston, Texas. And today we're going to be talking about diabetes, a functional medicine approach. So, Dr. Bob, great to have you in these calls. As always, sharing your knowledge, wisdom, and passion for human health and for well-being and solutions, and being a truth seeker and truth speaker. So welcome to the call.
Well, thank you always, Eric. Happy, beautiful day all. And we have a big and expensive and huge problem that we have really good solutions to if people are willing to make a few simple and maybe some not as simple choices, but very, very, very manageable almost all the time, better than what most of the world is managing at the moment. So I'm excited to share.
We're talking about diabetes, and I know there are 3 different kinds of diabetes, which I've learned now from your expertise and numerous talks over the past number of months and years. Can you share with us, Dr. Bob, what are the 3 different kinds of diabetes and how do they affect the body?
Oh, absolutely. So, when we start looking, and I think you can see my screen now, classically, they would talk about type 1, which, by the way, they used to call that juvenile onset, and they would call type 2 adult onset. But with type 1, this graphic says no insulin. How about just not enough to get sugar and nutrients into the cell? And there's a whole lot more than just sugar that gets into the cell. Insulin's absolutely life critical, but there's some type of destruction of the cells of the pancreas. Now, that can be an autoimmune attack. It could actually even be a physical trauma, believe it or not. They have physical trauma that can destroy the pancreas. Even certain chemotherapies were known to destroy the pancreas, and we can talk about solutions for that too. Type 2, the body really just doesn't respond to insulin like it should. The pancreas could make enough insulin, but the person's habits are so poor, their cellular response is so poor that it almost looks like the insulin doesn't even work anymore. And then they become what we call a type 2 diabetic. And most recently, they're calling Alzheimer's a type 3 diabetes of the brain. We might even find some subtypes in the future, but how do they affect the body? My mentor said years ago, friends do not let friends become diabetic. And quite simply because it's going to damage nearly every tissue of the body. Sugar plus protein forms a crusty protein. That's a process called glycation, protein glycation. And crusty proteins don't work anywhere near like they should. As the body becomes damaged, it becomes inefficient. And diabetes will take quality of life out of every year you have, and certainly it'll shorten your life progressively by how out of control the sugar is. So you want to control it effectively to live a long and healthy life.
And what's the scale of this problem today? I know there are increases across the board with cases for diabetes, but what are we dealing with here, Dr. Bob? What's some of the data on that over the last 10, 15 years?
Well, let's start looking at money first. 1 in every 7 sick care dollars is spent on it. And so it's the most expensive problem in the entire sick care system. And the interesting thing is we don't really know what the impact is. They actually suggest that the majority of diabetics haven't even been diagnosed yet. A bunch of pre-diabetic and diabetic people walking around and a bunch poorly managed. And even with that, even with the undiagnosed impact, 1 in 7 sick care dollars. So here's the deal. As you become progressively stressed, as you become progressively toxic, as you become progressively obese, all these factors have a negative impact on blood sugar regulation. And therefore, as we look at the world, possibly being more stressed than they've been in modern times, being more toxic maybe than ever, and certainly obesity is at an all-time high. Clearly, there's something brewing here that we need to address and solve. So the overall impact, biggest problem in the entire sick care system, and I don't even think we know how bad it is.
You mentioned as well, was it yesterday, I believe, or on a previous call, that the fastest growing demographic of those cases are actually children.
Yeah, that's exactly right. And so, it's been that way now for decades. And I'm kind of going through the slides that I have because Time had a cover story years ago, and I'll bring it up now. And they were talking about, this horrible pandemic of diabetes. So, this cover story here shows this 11-year-old girl with diabetes. And notice what it says, are you at risk? Who's getting it? Why it's striking so many, as if it just strikes, like an invader in the night, and what you can do to fight it. Well, quite simply, live healthy, you'll be healthy. But this is now decades running, where they had to change the name from adult onset diabetes, which they call type 2. It usually took decades to wear out your pancreas. And now, we have people in single digits getting it. And that is the fastest growing demographic: children's, teens, young adults. And it's got to stop. It's got to stop, because it'll cut their life short. And again, very poor quality of life. So that was actually a 2003 cover story. So this has been cooking for a while.
And as a functional medicine doctor, what do you see, Dr. Bob, as solutions for this problem? This is not something that's going to be solved overnight, obviously, because it's been brewing for many years. But what are people going to have to do to help turn this around?
Well, take responsibility for their health. I'm a big fan of this concept of extreme ownership. We could expand on this as much as you want. We talk about the Magnificent Seven. You've got to eat right, drink right, think right, move right, sleep right, poop right, talk right. Every one of those is going to have a factor. But simplified: stress, all the stress hormones oppose the action of insulin. Toxins, there's a significant accumulating body of data that as the world has become intoxicated, it's become progressively obese, progressively ill, progressively inflamed, progressively diabetic, progressively cancerous, progressively autoimmunity. These toxins are really, really, really bad animals. And, move their body, quite simply, and nourish your body appropriately. And here's what we know: if you're malnourished, you're going to be consistently hungry. If you keep eating food in it that doesn't have something, the nutritional value, you stay hungry. You don't have satiety. You keep eating, you overeat, you get over fat, and that complicates the circumstance.
And from your standpoint, from a functional medicine practitioner, you've mentioned this before on different calls, that certain medications have a failure rate. I believe it's metformin after a number of years. Obviously, with type 1 being autoimmune, that's a different beast in order to control. But what kind of solutions holistically do you give people and educate people on as a better way?
Well, first and foremost, all of the diabetic drugs have a failure rate. In fact, every drug is going to have a failure rate at some point in time. I'll share the data on it here because, I've had pharmacists that have been in my audience and they go, oh my gosh, I never learned about this. We look, and there's your PubMed ID for people that want to look at it. Metformin, the top type 2 diabetic drug in the world, more than 1 in 5 are going to have a failure of that drug at 5 years. And then the other types of drugs. And what they tend to do is add a drug, add another drug, and they might even add insulin where their sensitizers aren't working anymore. But very, very simply, we can start moving people in better and healthier directions. And they can see in a very short period of time, their sugars begin to drop. And, I'll say it again many, many times, most diabetics on insulin know how to regulate their insulin, but most patients on drugs don't know how to regulate most of their drugs. So they're very confused as their sugars start to drop. And I've had some patients say, I had to stop that nutrition program. Why'd you have to stop it? Well, my blood sugar was dropping too much, too fast. I said, well, that's interesting. Are you still taking your diabetic drugs? Yeah. So you want to stop something that's healthy for you and continue something that's harmful for you that actually brought you into my office in the first place. And they think about that for a moment. Now, I can't give them advice how to wean, but I can send them back to their provider or to a good quality pharmacist and say, share your data with them. And the good news is a lot of diabetics are good at measuring their sugar and say, what do you think? Can I reduce my dose? And these people sometimes they're waking up with a sugar of 50. And you know what? Of course, they're going to say, well, certainly you can reduce your dose. And we see plenty of people get off of medication fast. And, I have a video that I'll probably share later tonight. But, I'll show a picture of a woman who came in taking 8 different drugs with her sugar out of control. And believe it or not, in a day. And that's the fun thing about the video that I shot with her. She was off of the diabetic drugs with her sugar in an ideal range. So this was actually her day 1. And, when I filmed her, I said, look, I rarely film people the first day, but I have a feeling you're going to have a really epic response. And then we look at her 9 months later, certainly looks very, very different, but, 38 pounds lighter, 0 drugs. And, initially they were talking about dialysis. They said, she told her doctor, I'm worried, my kidneys are beginning to fail. And he literally looked at her and said, that's what dialysis is for. And that's where she had an epiphany and said, wow, I need to take a different approach. But understand, if you look around, if you're in the US, oh my gosh, dialysis centers are popping up all over the place. I've got a patient that specialized in building dialysis centers, and he retired a multi-millionaire with always building, and sold his company for a huge profit because they're popping up all over the place. And can it be prevented? In the vast majority of cases, absolutely. That's our experience. And even people that have been told dialysis is for you, some of these people we've been able to reestablish kidney function where they no longer need it. So pretty fun stuff.
What you're saying there is type 2 diabetes is absolutely reversible when it comes to, looking at a more natural approach with lifestyle and functional medicine interventions like good foods, functional foods. That's a reversible case pretty much for most of your patients who've come into your practice, Dr. Bob?
Yeah, typically in 60 days. Now, the extreme cases have taken as much as a year, but I'm not going to limit it to type 2. Type 3, this book, The End of Alzheimer's, Dr. Dale Bredesen, I think it was 8 years ago before he had published this book. He was one of the major lecturers at a conference that I was a lecturer at. And he said, look, we're reversing Alzheimer's. And they have hundreds of documented cases of that being reversed. When I show the picture of this foot, this was a diabetic foot that was scheduled for amputation. But ultimately, what Dr. Bredesen would teach is there are 3 distinct zones of cells whenever there's this problem. There are cells that are dead. Well, there's nothing we can do about that. There are cells that are fine. Nothing we need to do about that. But in between are cells that are functional but not functioning. And if we get back function, guess what? We get back function. And they're showing that. And I'm scrolling on the left. You people will probably see that on the screen. But I will share with you then data about organ transplant, where now there's even hope for type 1s. I got to figure out where I have that. So give me a second to find that. But, they did the very first, they call it a xenotransplant. They put a pig heart into a human. And you know what? They extended his life by a few months. That's a good start. Not as much as they wanted to get, but they finally got it in a human clinical trial. But they have this ability now to transplant organs. Ultimately, they put a pig heart into a human. They would actually digest out the genetic material, and then they would actually infuse stem cells. This has been at least 10 years of research, and something that's also being researched right now is the islets of Langerhans. Those are the cells of the pancreas that make insulin. Now, first one, 2 months. You know what? We'll call it a success, a short-term success, and we'll build on it. But I think this is a very good application of medicine. But, as this pig heart transplant patient who died after 2 months will tell you, you'd probably be better off taking care of your original equipment, for as long as possible. And I've had people where we've been able to delay, for instance, hip replacements for a decade. And let me tell you, the technology of hip replacements and the expertise and skills has gone up exponentially. And I see that happening with organ transplantation too. Take really good care of your original equipment, but I think there are going to be advances that'll help people tremendously. And that's ultimately, going to be a boom for mankind, but nothing like our original parts, that's for sure.
That is absolutely true. I always say to clients, we have a priceless, precious machine. Don't treat it any other such way than what it is. It can be forgotten sometimes, but I think once you really get into those consistent habits of self-love and awareness, that's a big step in the right direction. And make sure you surround yourself with people that are demonstrating health. There's no point in getting health advice from someone who doesn't demonstrate health. It's absolute madness to think that you're going to get that kind of feedback from someone who doesn't have the experience. And a lot of people can go on Google and find loads of things and different bits of information. It doesn't always mean that it's actually accurate. For yourself, Dr. Bob, I know you reference from PubMed an awful lot. That's somewhere you would usually refer people to if they want to do their research, so to speak. As there are a lot of, companies and websites that are bought out by bigger pharmaceutical companies, and essentially they have the say on what goes on those websites, and not always serving people's health with the information. So PubMed would be the one for you to guide people towards.
Well, even PubMed has its limitations, Eric. They actually found out that if you only read the conclusions of the article, they actually call it spin. And I can actually do a quick search on my computer and look at spin. But what they found is there's a bunch of articles where the results of the study did not actually show what the study showed. So, for instance, they said, well, here's what we find. That this is really, really, really good. And here are the reasons why. But when you go look at the data, the article, it actually did not have that level of conclusion that could be drawn. And I just found it on my computer. So let's see if I can open it. But it was 40% of the studies. Due diligence really takes on a whole new thread. This was 2010 Journal of the American Medical Association. Here's what they said. The purpose of their study was to identify the nature and frequency of distorted presentation, or spin, specific reporting strategies, whatever their motive, to highlight that experimental treatment is beneficial despite a statistically non-significant difference or even a negative difference at times. And here's what they said. More than 40%, more than 4 out of 10 were distorted in terms of what they were presenting. You start looking at, there was a vaccine that they were giving to prevent HPV, and they wanted to study, okay, is this associated with autoimmunity? We talked about this last week, over 2,700 studies on vaccine-induced autoimmunity. And I had a girl come in, I don't want to get too elaborate on this, but she was a gymnast in danger of losing her scholarship because she started gaining fat really, really fast. She came in a very elite gymnast, and she was 20 pounds over fat, 30 pounds over fat, 40 pounds over fat, couldn't compete like she could. And what they came to realize is that she got this vaccine and developed an autoimmune thyroid circumstance. What they ultimately found out was that there's a huge increased risk of autoimmune thyroid, but the spin doctors didn't really share the absolute data on it. Maybe I'll just, actually, I'll share the screen because I did open it up. So, and this one has super big font, but notice what it says. No autoimmune safety signal was found in women vaccinated for HPV-4. That's the conclusion of the article. Now we just go up a little bit, and this is right here in the results section. And here's what it said. None of the estimated incident rate ratios was significantly elevated except Hashimoto's, which is an autoimmune thyroid circumstance, which went up by 29%. That is statistically significant. And then we go back, and what did we find out? No autoimmune safety signal was found. So how did they draw that conclusion a paragraph later? That's a classic example of spin. And it's been used, again, 4 out of 10 times in the medical literature. So, hey, PubMed's a good start, but really understand what you're looking for, how you're looking for it, dot the I's, cross the T's, and look for multiple studies. That's what I would recommend.
Excellent. Thank you for giving us that navigational tour of how things can be tweaked and changed to alter what way the information is given to people. And I think it's really about, like you said, doing your due diligence, getting the information from multiple reliable sources, and then making a decision that serves you and your family best. But when it comes to type 1 diabetes, we understand that is autoimmune, that is connected to our genetics as well, I believe, to a certain degree. What role do genetics play in type 1 development, and of course type 2, and in fact type 3?
Minor, so we start looking at genetic predisposition, and what we're going to know is that the consensus is 90 to 95% of our health, for a typical person, is going to be lifestyle choice. 5 to 10, lifestyle, by the way, we'll use that term epigenetics, above the genes. 5 to 10 is going to be, for a typical person, that's going to be genetic. Now, we're not talking about genetic disease. If someone has a full-blown genetic disease, we're going to have a harder time with that. But even when they have genetic disease, we know that our genes can either be expressed or not expressed, turned up or turned down based upon our choices. So I would say in those cases, lifestyle is even more critical. But certainly for people without a genetic issue, genetic disease, 90 to 95% is going to be our choices.
Wow, I didn't realize it was that high. That is pretty significant when you consider the direction a lot of people's lives are going in when it comes to the data and the instances of diabetes going up and up and up every single year, it seems. And obviously with COVID now, people's stress went up to a new level. I think a lot of people were struggling and maybe became less active, of course, with the isolations and lockdowns. Gyms were closed. Perhaps people overindulged on food as a comfort of dealing with this stress. It's been a problem. It's been a problem for people to get back to those consistent habits. So what kinds of foods do you feel are really, really optimally balancing our sugar levels that we need to be getting in on a daily basis to make sure that we are sufficiently fueled to deal with everything that's coming at us in life.
Eric, I want to just expand slightly on that stress issue real quick, because you made a very, very important point. And this is Diana Schwartzbein. I saw her at a conference years ago and was just amazed at her wisdom. Turns out she's an endocrinologist in Southern California, and she was taught to recommend the American Diabetic Association diet. And she said she had a bunch of patients that were engineers, and they said, all right, I understand I need to measure to monitor. So they'd test their sugar, they'd eat the recommendation by the American Diabetic Association, their sugars got worse. But when they ate a natural, unprocessed, ketogenic, paleo keto, really type pyramid, leans, greens, nuts, and seeds, minimize your starches, they got dramatically better. This was one of the more insightful things that I heard her say. She said, look, insulin is outnumbered 5-1. And so the three stress hormones, adrenaline, noradrenaline, those are also known as an epinephrine, norepinephrine, those oppose the action of insulin. So does cortisol. By the way, so does glucagon and growth hormone. And now growth hormone, by the way, if you're naturally releasing it due to intense physical exercise, it's one of the most powerful fat burners that we have. But interestingly enough, if you do it by injection, and there's reasons for that, if there's dwarfs or things like that, then they can have a problem there. But back to your question about the food, if people are familiar with the term keto paleo, then they'll understand what I'm talking about. But I'll show keto paleo pyramid, which is essentially leans, greens, nuts, and seeds. Even Stephen Gundry, who somewhat of a functional medicine cardiologist, he said, look, if it's white, keep it out of sight. And that's a pretty good rhyme. So it seems to make sense.
Apart from egg white, though, I'm sure.
Well, remember, the egg white ought to be clear before we cook it. So we're going to be okay with that. And by the way, natural eggs aren't white. They're bluish, they're green, they're brown, so if they had an appropriate picture here, it wouldn't be so white. It'd be more of a beige or a brown or even a blue. Pretty fascinating there.
When it comes to intermittent fasting, Dr. Bob, this is something that I've been experimenting with the last year plus, I guess, just because I've organically slipped into it and I feel good with it. How beneficial is that for diabetes across the board and this benefits for balancing sugar levels?
Well, I love that you asked that. And here's what I'm going to do. I'm going to go live and I'm going to just do that search. So I show people when I get a question that I don't off the top of my head know the answer to, which is, often enough, or maybe someone comes in that a condition I hadn't heard of, I do go to PubMed.gov, even with the incidence of spin, but I'll type in intermittent fasting, right? And I'll just for the fun of it, we'll see 134,000 studies. So this is nothing new. They studied it going back to 1809 in the medical literature, and it took until 2016 for a Nobel Prize to be awarded. So people have known about this for a long, long time. But let's type in diabetes, and I'm going to guess over 1,000 studies. Let's see what we come up with. Well, I was way off, right? So 57,000 studies, low calorie diets, intermittent fasting, obesity, type 2 diabetes, et cetera. Notice this one says therapeutic use of intermittent fasting as an alternative to insulin. So when they're talking about type 2 diabetic people, they're saying okay, they're no longer responding to the insulin sensitizers. They beat down their body so bad. And the next medical option, probably before 2018, was, okay, now we're going to add another drug. But then they say, well, you know what? You could actually eat less food less often, and that would do the trick. And by the way, it might even reverse it all the way, because take a look at this first one here. The role of low-calorie diets, intermittent fasting in the treatment of obesity and type 2 diabetes. And here's what I'm going to predict. It's really, really good for it because I've seen it over and over and over again. Here's what they said. I bet it worked really well in this study. I just went right down to the conclusion. All right, so here's what it says. The result of recent clinical trials show that this probably is low-calorie diets and intermittent fasting in patients with obesity, including those with coexisting type 2 diabetes, can lead to a reduction in body fat mass and metabolic parameter improvements. But then notice the conclusion. We need to study it more with larger scale trials. Okay, cool. I'm okay with that conclusion, but share the data. How much did they improve? And I'll bet a lot. And so, again, 57,000 studies. Do we need to read all 57,000? how about we just give it a try with people? And this is part of what I've been doing with people for 30 plus years with profound effectiveness. And I'll say it again and again and again. My typical type 2 diabetic patient is non-diabetic in 60 days. Now, what about satiety issues? Well, guess what? When we give them nutrient-dense foods, that could be medical food shakes for diabetes, that could include superfoods like Reishi or Ganoderma Lucidum. Those are proven to enhance satiety. We get them moving their body, they start burning off the fat. Guess what? Then they earn their calories. They can get a few more calories. And if we can get them in that fasting window, and I like to give people fiber, and there's some good fibers out there that taste, whether they're orange or strawberry, the flavoring wouldn't be what I'd be most in favor of, but they put it in hot water, it gets gelatinous like pudding. And when they eat it, they get satiety without calories. And would even improve bowel function. So there's so many different ways we can do it. I would encourage everybody that's watching this, if you have an issue with appetite and want to try intermittent fasting, get yourself a good tasting fiber. Dose yourself with it, see how it goes. And I'll tell you, Bo, you do need to drink more water because believe it or not, even though fiber can improve bowel function, if you don't get enough water with it, it can have the opposite effect. And no one should be constipated. That's human torture. We all need to eliminate very, very consistently or poison ourselves with our bowels. So let's not do that.
Absolutely. No, I couldn't agree with you more. Yeah, there's nothing more upsetting when the gut is under that kind of trauma. And you mentioned about Reishi or Ganoderma. I know we love sharing Reishi and Ganoderma with the world. A superfood, a king of superfoods among superfoods, really known as the king of herbs in Chinese medicine. What is Reishi, Dr. Bob, and how profoundly beneficial is it for balancing sugar levels and, of course, for the likes of diabetes?
Well, again, it's very, very profound for diabetes. So it's the top superfood on the planet. So as a top superfood, it's got all the fabulous 50, all the vitamins, minerals, amino acids, proteins, carbohydrates, fat, fiber, and water in doses that make a difference to human health. And so it's, for that reason, considered almost nutritional perfection. But it also is very, very good at protecting the beta cells of the pancreas from autoimmune attack. And they've done studies on it where they could generate an autoimmune attack on the insulin-producing cells by infecting the pancreas with a virus called Epstein-Barr. But when they give Ganoderma and Epstein-Barr, the animals do not develop type 1 diabetes. That's very, very powerful. It works in the liver by the exact same mechanism as the drug metformin. Changes the bugs in the gut from an unhealthy state to a healthy, favorable state, which is important for inflammatory process and insulin signaling. It alkalizes the system. That enhances the efficiency of all chemical messengers. We just go on and on. So many different benefits, including satiety and even energy efficiency. So people won't eat as much and they can exercise more. And all these are important for everybody, but especially the diabetic patient.
Beautiful. And we've talked about habits, the way people, go about their day. We are creatures of habit. Tell us about the genius of the delivery system of our partners, Organo. They've infused this in a way that people enjoy, want, and love on a daily basis. Can you just share how important that is for you as a practitioner to have this in your arsenal as a tool to help people get to where they want to go with their health?
Well, I don't know who said it first. Consistency trumps intensity. It might have been Bruce Lee, and he'd talk about just train, be consistent, be consistent, be consistent. And people are not consistent with their nutrition. I can tell you that when I've treated world champion athletes, Hall of Famers, when they were in season, when they were going for the gold medal, when they were going for the Super Bowl or the multi-million-dollar contract, they were profoundly consistent because their livelihood depended upon it. But as soon as that season ended, career ended, whatever, usually career, because the Hall of Famers, they realize that, the season is 24/7, 365. But after the career ended, they drifted away from the things that made them successful before. But when we start talking about coffee or tea, people who drink coffee or tea never need to be reminded, never plan to quit. And across the globe, we're looking at each over 2 billion cups a day, every single day. Let's just put this in perspective because, as a numbers guy, here's what I can tell you. 1 billion years ago, no life on planet Earth. 1 billion days ago, no human life on planet Earth. 1 billion hours ago was the Stone Age. 1 billion minutes ago, the Roman Empire. 1 billion seconds ago, nearly 32 years ago, but 1 billion cups of coffee ago, that was less than 12 hours ago. You start looking at that, the world does it, and they never need to be reminded. They never plan to quit. So when we put this turbo superfood in their coffee or tea, every sip moves their body towards a greater state of health. We've seen it in our own lives with our clients, with our patients, with our friends, with our family. It's a game changer. It absolutely is.
Guys, if you have any questions for Dr. Bob, please put them in the chat. We have just a couple of more minutes just to address any questions that you may have. I see Rob has mentioned here as well. I was given permission by my doctor to self-regulate my insulin dosage after around 6 months of diagnosis. So obviously, was that in with your guidance, Dr. Bob, or was that?
Oh, no. No, but he says type 1.5 diabetes. Suddenly I find myself going, well, what the heck is that? I want to understand what question I'm answering before I attempt to answer that question. So I'll just go here first rather than PubMed, because if I'm just hearing about this now, I want to first see what Mr. Google has to say, because I can probably get also called latent autoimmune. So if it is autoimmune, it shares characteristics of type 1 and type 2. Fascinating. That's a new, there are autoantibodies. So if the antibodies are destroyed, they might need insulin. So let's go back to the question then. All right. Given permission by my doctor to self-regulate my insulin dosage. Well, that's good. You want to, and ultimately less is better when it comes to giving insulin, because your body can actually begin to reject the insulin. And so, that's one of the challenges with it. So what specifically is the question? I was given permission to regulate my insulin after around 6 months. I think he was just making a statement. And then he says very, very simply, don't confuse ketosis with ketoacidosis. Yeah, you're not going to get into ketoacidosis dietarily, but guess what? Without a controlled diabetes, you absolutely can. So very powerful there.
There's another question from Anne there in regards to Graves' disease, how to reverse it, what protocols, lifestyle changes to incorporate to best make those changes.
So we can actually go back to our diabetic lecture for a moment, because since type 1 is autoimmune, I've listed the universal immune modulators. And so ultimately, what we want to do is seal and heal the gut and give the immune balancing nutrients. So I'll share this screen and you can screenshot it, or I can even send you, I have a mini course on autoimmunity where I go over each of these with the PubMed references, but universal immune modulators to actually protect the body from the immune attack, which, by the way, it is attacking bad cells, vitamin D, DHEA, Ganoderma, Lucidum, the resolvins form of omega-3s, and ultimately seal and heal the gut. Since Graves is autoimmune, it's much less common than Hashimoto's, and also more dangerous. So if someone has Graves, Hashimoto's we can often handle very, very effectively, but Graves typically needs to be under medical management as well, because too much thyroid hormone, you can have cardiac arrest and permanent damage or worse. So we want to use those immune balancing nutrients.
Excellent. Thank you for clarifying that, Dr. Bob. There's 2 more questions from Anne.
Yeah, embryonic pregnancy causes. Doesn't sound good to me. And so I'll have to look that up. We're having a fun day of sharing screens, and actually, there's plenty of things I don't know and other things I hadn't heard of. So I hadn't heard of type 1.5 diabetes. It's basically late onset type 1. So how about we just go right here? What's the causes of embryonic pregnancies? Embryo never develops, reabsorbed, leaving an empty gestational sac. Okay, so without embryonic means there's no embryo in there. The reason this occurs is often unknown, but it may be due to chromosomal abnormalities of fertilized eggs. So, Anne will know this. God doesn't make junk, and if somehow, some way, there's a fertilization that wasn't meant to be happen, then the body will reabsorb it, and that seems to be what happens. But maybe there can be, since the gestational sac will form, I'm betting that it can actually create hormones that would actually even be detected as pregnancy. So notice, then I just looked this up, clinical signs and symptoms, pregnancy test, etc. HCG levels, so that can happen. So the placenta can actually fool the body. So, and it wasn't meant to be. Healthy moms, healthy babies. This was just one of those things where the fertilization didn't happen right, and we can say either God took care of it or nature took care of it. But it was certainly meant to be that way.
Just the final question there as well is around infant vaccinations. I know we touched on this last week as well. Any alternative other than refusal?
Well, do your due diligence, take a look at them, see what have they actually really done, what's the benefit. Now, one of the things that I do is I look at the history of things. And so if we go to the history of vaccinations, for smallpox, there was a procedure called variolation. So that's variolation. And when someone had smallpox, they'd take a smallpox lesion, and let's say it was on the arm, and they would cut it open. And then they would take a healthy person's arm and they would cut it and they would commingle the fluids. And what would happen 98% of the time, the person would get a mild case of smallpox, beat it, and go on with their life. 2% of the time, they'd have a severe case, and sometimes they'd die. Then Jenner had made the observation that milkmaids that got cowpox didn't seem to get smallpox. I wonder if variolation with cowpox could create a similar thing, and they found out that it did. So they used a natural infection, a natural wound, natural body fluids, natural immune response. And that was the origin of the original vaccine. And then that somehow morphed into using mercury, aluminum, formaldehyde, aborted fetal stem cells, and injecting these things. And I think the current guideline is, somewhere between 70 and 80 of these by the time the child is 6 years old. And the first shot is hepatitis B. And Anne, you're going to appreciate this. So, our children were born in the hospital by a C-section. So I'm grateful for that portion of medicine. Kelly's family, that's just kind of how their pelvis is put together. And I'm grateful she didn't die in childbirth. And I'm grateful for 3 beautiful, healthy children. Now, my daughter, guess what? She had a healthy, easy delivery. Well, I call it easy, right? But beautiful, natural. My daughter-in-law also the same. We can call it easy. It's not, right? So, but at any rate, we met with the pediatrician, and I asked the pediatrician. I said, "Well, doctor, I understand you want to vaccinate for hepatitis B, but how does one get hepatitis B? Could you educate me, please?" And she said, "Well, certainly. That's anal receptive homosexual sex or the sharing of IV drug needles." And my next question, with this confused look on my face for drama effect. "Doctor, I'm confused. What makes you think my child's at risk?" And her answer, "Well, you just don't know how they're going to grow up." Well, we'll cross that bridge when we get there, but we're not going to inject a child with mercury, aluminum, formaldehyde, and a virus that's transmitted through, anal receptive sex or the sharing of IV drug needles. It didn't make any sense to me. If it makes sense to you, and you've done your due diligence, then God bless you. You make a decision that's good for your family, and, we'll pray for a good outcome. But if you haven't done your due diligence, then guess what? I don't think you're honoring the gift that you've been given. So I would encourage everyone to honor the gift, especially of our children, but even your own self. Our own life is something to be cherished and really taken care of.
Beautiful. Just very last question, because I know we're out of time. Which products of Reishi are best for cyst on larynx?
Well, I'm going to go with spores, and I haven't seen any study for cysts specifically on larynx, but even believe it or not, there are studies on polycystic kidney and Ganoderma, and it shows that Ganoderma shrinks polycystic kidney. Now, it turns out that the spores are the most powerful, and polycystic kidney is common, and it can lead to kidney failure if they start growing. So, I like 2 spores every waking hour. And you know what? We certainly want to see it work, and bodies respond to frequency, duration, intensity, quality, and timing of stimuli. Eric, I see one more. So Rob says, is there any circumstance where the body could overproduce insulin? And, it might be an oversecretion because the body's, trying to really shut down a high level of carbohydrate fast, but overproduction, you would start thinking a tumor, and that's a possibility. And so, like, I read a study about something called a pheochromocytoma, which is an adrenal tumor. And these people make a ton of catecholamines, the epinephrine, norepinephrine, and that's fatal, most of the time. But the study I read, the guy actually beat it with natural remedies. So I find that pretty fascinating. So overproduction is much less common than underproduction, where the gland is burned out, or under-responsiveness is most common. Under-responsiveness because the tissue is not healthy enough to respond.
Thank you for touching on that one. Sorry, I missed that one, Rob. So guys, thank you so much for being on the call today. A lot of knowledge, a lot of info for you guys to digest. There will be a YouTube version of this put up on Dr. Bob's YouTube channel as well in the next 48 hours or so. So you can check that out and share it with anyone who didn't get on the call today, but also you have a chance to connect with people who may be able to come on to the 6 p.m. Central Standard Time call today. Dr. Bob will be revisiting this subject for anyone who couldn't make this time slot. Saturday, we'll be having a conversation around our business, our global digital franchise, around how we share Reishi coffee and tea and other products with the world in a way that adds value to you, your family, and everyone around in your network. And the following week, we will be kicking off with a new section for health calls as well. So we'll keep you guys informed as what's coming with a new calendar in our Facebook group. And if you want to be added to our Facebook group, learning more about Reishi, then please reach out to whoever invited you on this call, and we'll get you invited into that group. So I'll hand the last words over to you, Dr. Bob. Thank you once again for sharing your time. Thank you all for your attendance, showing up, and showing some love as well. So Dr. Bob, over to you.
I'm going to wrap up with 4 questions. First question is why? Why'd you take the time to join us today when there's so many other things you could do? Second question is the answer to the first. Why not? Why not learn a different point of view that actually is backed by science, clinical experience, and success? Third question, why not you? Someone's going to take this information, they're going to apply it, they're going to share the replay, they're going to let their friends that are struggling know, hey, there may be another choice. And if it's right for you, it might be a better choice. And here's the final question, why not now? The longer you wait to act on information, the least likely you are to act on it. So you know what, make a better choice for sure. And if you know someone that can benefit, then guess what? Reach out to us with the tag. It'll be on my YouTube channel, Dr. Bob Rakowski. The world needs all the help that it can get. So if you're in the part of the world that's evening, good night and God bless. If you're in this part of the world, good day and God bless.